All right. Well, welcome to the Mentoring Keys to Grow the Disability Health Workforce webinar. My name is Hilary Brown. I'm an assistant professor at the University of Toronto, and I will be the moderator for today's session. We're very excited to engage in a discussion about mentoring, careers, and more. And we have a fantastic panel with us today, who I will briefly introduce. First, we have Dr. Monika Mitra, the Nancy Lurie Marks Professor of Disability Policy and Director of the Lurie Institute for Disability Policy at Brandeis University. We have Dr. Vijay Vasudevan, Director of Data Science and Evaluation Research at Autism Speaks, and Dr. Michael McKee, Associate Professor, Director of M-Disability, and co-director of the Center for Disability Health and Wellness at the University of Michigan. I'll just briefly mention that we have CART and ASL interpreting available, and thank you very much to our access workers today. If you have questions throughout the webinar, please feel free to put them into the Q&A, and we will make sure to get to them. And before I jump into the questions for our panelists, I'm just going to turn it over to Mike briefly to tell us a little bit about the American Public Health Association Disability Section Mentoring Program.
Thank you, Hilary. So again, just brief introduction. I'm Mike McKee. I just want to briefly describe myself. So I'm a white, middle-aged male here at a clinical office. And so I'm wearing a striped, mostly white t-shirt, like long sleeve shirt. So I wanted to just highlight a few partnerships here. So we have the American Public Health Association Disability Section Mentoring Program. So this is a great resource. What we're trying to do is provide enhanced opportunities for trainees, students, and early career professionals who have a disability to be matched with mentors who have a disability or interest in disability health. And we look at a variety of background variables to try to match. So it's not just going to be on disability, but there may be additional recommendations or requests such as race, ethnicity, sexual and gender orientation. So I also wanted to acknowledge that the Disability Section Mentoring Program, in addition to the partnership with the RRTC. So we have a grant that's called Advancing Health Equity for Adults with Disabilities from Diverse Communities. And so this is a grant funded through the from the National Institutes of Disability, Institutes of Disability and Independent Research. I'm sorry, it's on neither. So National Institutes of Disability, Independent Living, and Rehabilitation Research. Sorry, I got that confused. So I want to acknowledge the grant funding that we got from this group. And so in terms of partnership, what we're trying to do is work with a variety of partners across the country to make sure that we have opportunities for our trainees to be matched in a variety of different levels. Thanks.
Thanks, Mike. So we'll jump into some questions for the panelists. And again, if you have questions of your own, please feel free to put them into the Q&A. Just to start, I'll ask each of the panelists to please introduce yourselves, including your research interests and your current work. So maybe we'll start with Monika.
Thanks, Hilary, and thanks for inviting me. I'm Monika Mitra. I direct the Lurie Institute for Disability Policy. I'm at Brandeis University. And for 20-something years, my research has focused in this area of health and disability. And largely it's been on health disparities in access to health, in health services research, all within all focused on disability and disabled people across the lifespan. In the last about 7-8 years, a lot of my research has kind of naturally sort of moved to sexual and reproductive health, perinatal health of people with disabilities. Some of my work is also, again, in the last few years, also looking at intersectionality and really looking at disability and other marginalized identities. I'm going to stop here and move to Mike and Vijay.
Go ahead, Vijay.
Thanks, Monica and Hillary. I'm Vijay. I use the he, him pronouns. I'm wearing a black and white shirt and have brown skin, and I've got black and gray hair. I'm in my home office, which also has a blue background. I've gotten into the disability and public health world about 15 years ago, just to kind of learn more about the social determinants of health and how that impacts for disabled individuals. And in my current world, I've taken from data science trying to explore how big data can be utilized at a local community level, trying to make sure that data is actionable for individuals who have different disabilities, specifically autism in my work, but exploring how we can utilize that information for advocacy, translating that information for people who are from other marginalized communities, and making sure that it is applicable for individuals from whether they're caregivers or an autistic individual, policymakers, employers, and educators.
And Mike.
So I'm Mike McKee. I'm an associate professor here at the Department of Family Medicine with the University of Michigan, and work closely with many of us here and also with collaborators across the country. So I currently direct MEM Disability and also co-direct for the Center for Disability Health and Wellness. And so this grant that I mentioned earlier is also part of that Center for Disability Health and Wellness at University of Michigan. So I look forward to this session because it's really something that I certainly benefited from, especially from prior mentors who also were deaf or hard of hearing. So I'm looking forward to this discussion. Thank you.
Thank you. So we have a number of pre-planned questions for our panelists, recognizing that audience members might be at various stages of their careers, from thinking about graduate school to thinking about the job market and other kind of considerations across that spectrum. So with that in mind, I'm going to start with a couple of questions about navigating graduate school or health professional programs. And I'm just wondering if the panelists can speak to any advice you have for individuals when choosing graduate and health professional training programs, including, choosing the right supervisor, choosing the right mentor, that sort of thing. So whoever wants to jump in, please go ahead.
I'll go ahead and start first. So one of the key things that I have noticed for myself and also others who may have a disability is that we often navigate during our childhood years and adolescent, teen years, where we often hear people saying, no, 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 don't go into that career. And so we have to navigate through a lot of naysayers. And it's not until we often find champions who early on say, you know what, you can do it. And I know I had two in particular when I was much younger, and both of them were in the science and engineer fields. And both of them were deaf. And it was, for me, shocking that they were able to do it when I heard for so many years that it was impossible. And so what I do notice is that it's important for us to not only support, but give them opportunities to be able to navigate and get exposed to various careers. So because of that, I actually was sort of uncertain what career I was going to pursue. And it was really helpful for me to be able to jump into different kind of work environments, shadow people to see what excited me. Certainly, I had personal interests in science, and so that's always been there. But it wasn't until I had that additional opportunity of people saying, you know what, you can't do it. Also seeing people who were future role models, in addition to having exposure in the work environment. So I encourage people to really just don't be dismayed. Try to seek out those shadowing opportunities so you can actually find a career that excites you. And I know that certainly was really key for me.
Thanks, Mike. Monika?
Just building on the important points that Mike raised, I think it's not always the best, which is the best. It's an environment that's supportive. So and a mentor that is going to be there for you, is going to support you throughout this process, because there's always ups and downs, there's always obstacles, and it's really how, not only how you navigate it, but how, is the, whatever environment, whether it's a doctoral program, a postdoctoral program, is, are there people there who can support you through this? And some of the best ways to find out is actually talking to other faculty there, other students there, other postdocs there, and just getting a sense of, of the environment. The other, of course, is the research focus. It's all disability research is not the same. And so it depends on your focus and what you kind of see yourself, doing. And I'm also going to stress on research that's community engaged. There are some lot of excellent research programs and out there. And I'm going to just stress on the importance of not only conducting research that's community engaged, but also being an environment that is where this kind of research is ongoing.
Thanks, Monica. For my little bit of input on this too is to, I felt like it was the only time where I got to be selfish and be okay being selfish. I asked lots of questions to any of my mentors and others on my committee. I went and I met with a lot of the other faculty members and other students in the program after I got in. And it really helped me be aware of all the breadth of the research and work that was being done, but also reminded me that it was the only time where I really could be selfish to worry about my educational career, my pathway going forward, to make sure that all these mentors and others were there to help me move forward and get done with my program.
That's some great advice. Perhaps a more specific follow-up question. Do you have any advice for the panel for navigating conversations about disability-related access needs in academic settings? So, for example, through coursework or thesis work or that sort of thing.
So one key thing is often when we start, whether it's college or even graduate or even some health professional training program, when you start off, often there's going to be that initial array of what you think you're going to need, and then try to basically advocate to get those needs met. But what often happens as you go further into that journey, those needs and the services to meet them will likely have to change over time, whether there's another approach, new technology. So for me personally, with college, graduate, and medical school, what I would do is I would meet with the often the Students with Disabilities office, or something similar to that, and I would meet them early on to be able to advocate and say, these are some of the services I'm going to need. So it took a lot of advocacy on my part, which is, it is a little bit of additional effort that most students don't have to think about. And so I would encourage to meet early, frequently, to make sure that they're established. When I do see issues, in addition to people saying that they can't afford it, what often happens is that last minute scramble. So some of these services do require time to get in place. And one key thing for me, during my medical school career, during the training part, I did request sign language interpreting. And that was also really key for me to meet with them early so that they were comfortable with the medical terminology. So this is a terminology we talk about, learning 40,000 new words in medical school. So I wanted to make sure that the interpreters that were going to be assigned with me were also going to be comfortable navigating and working regularly, so that we had the ability to come up with terminology signs that were appropriate for that. So meet frequently, meet early, try to get that set up and adapt. Just don't be afraid to say, you know what, this is not working out. I need to pivot and I need to change it.
It's great advice. Monika?
Yeah, I mean, unfortunately, it does require extra effort. I mean, and that's the world we live in. I was going to say, and Mike, let me know what you think is actually when someone is considering programs is getting an understanding if the person is comfortable in sort of this environment of inclusion and access. Is is the university or the, and this, it could be, it doesn't have to be a university, right? If you're an early career professional and you're moving to, say, a nonprofit, is really to understand is what are people amenable to meeting access needs beyond what they absolutely have to. And I think that that's also that sort of getting a sense of the environment. How supportive are people? Do people get it? Do people are amenable to, baseline access needs, but also as someone's, as Mike was saying, as someone's access needs changes, is this going to be provided?
I think that also really builds on the idea of universal design, Monika. So that way, where we can look at something like how could we integrate accessibility and inclusion into these graduate programs, so that way we don't have to worry about what are someone's individual's accommodations that they might require, but it's just expected from the university and other groups. So, like as part of my graduate school, it was the Disability and Human Development Department at University of Illinois at Chicago, and they had accessibility and inclusion integrated into their coursework, and it was just expected. And I just never thought twice that this might be something that my disabled classmates would have had to accommodate just because it was at every session.
That's great. Yeah, Mike.
So I do want to also recognize that because of the additional efforts that students, trainees, and early career professionals often have to do in order to get these set up, it's important to recognize that they may need some support. So I know there was a study that was conducted by Dr. Moreland, and this was focused on deaf and hard of hearing medical students, trainees, and those who've gone on to become a practicing physician. And what they found is that it was on average roughly about 2 hours per week in setting up accommodations. So this is time taken away, whether it's personal time, family time, productivity. And so it's important to recognize that there is unfortunately, a burden on many of us trying to get these accommodations set up. So the more we can try to offload and find those key staff members who can actually help incorporate it beyond that initial visit to kind of assess on the needs that you may have. So it's important to recognize if you're going to be a mentor and advocate for your mentees, you need to understand that there is that sort of burden that we often have to navigate weekly. So.
Wonderful, thank you. So shifting gears a little bit to thinking about the job market, navigating the job market, thinking about career options. How can trainees and early career researchers frame disability expertise in a multidisciplinary field for individuals who might not be familiar with disability-related topics? Any thoughts on that?
That's a really good question. And unfortunately, it still holds true. Is that sort of proving the importance of disability? And this is actually not just in job environments. For example, how many MPH programs include disability? How many faculty actually have understanding of disability beyond it being a preventable outcome, right? So I think that sort of framing disability is unfortunately still really, really important so that people get it. And so I'm going to say if there's a job talk in an environment, say a public health school, where really what you're seeing is no faculty or programs are actually including disability in their coursework, in their research, is having a couple of slides just sort of framing, this disability not as an outcome, but that this research focuses on disabled people on, for example, access to healthcare environments or communication barriers. and then also with data, you know, and the importance of it. I don't have I don't have a perfect answer to this, because I think all of us still struggle with this in journals sometimes when we submit, and reviewers or even grant reviews. This is still a thing, and unfortunately there's a lot of ableist views out there where there's a lack of understanding, or even valuing the importance of the research that's ongoing.
I agree too. I feel like a lot of this, and in addition to bringing this information, is to make it personable too. So that way, if you're trying to constantly educate the others, it is exhausting to make sure that they're always understanding that disability and ableism is a major issue for the community. It just takes time, and I feel like that personal connection and that personal story helps gives some meaning for it too.
This is Mike. So I think it's important to recognize that many of us, because of the ableism that we experience growing up, some of that gets internalized. And so it is a process to offload that. I know early on, I often would feel shy, embarrassed asking for these accommodations. And when I realized as I've gotten further along, it's recognizing that I bring a lot of strengths. I bring diverse opinions, diverse set of skills. And so it's important to promote that and show it in a positive light. Sometimes we often bring it thinking a disability as sort of a loss of, or cost to the program. And that's not the reality. We often bring a lot to the table. So in medicine, for example, we deal with roughly 1 in 4 of our patients having a disability. So having us be part of that team strengthens the team, be able to care for them more effectively. Same thing in the research, nothing about us without us, having us be part of it. We can engage community members. We can also provide perspective that will help to make sure that we have an inclusive, accessible research infrastructure. Same thing for teaching. So it's important, not easy to do, but it's important to really show what you bring to the table rather than just sort of being tiptoeing. And I was guilty of that before, and I realized that that was the wrong approach. And at the same token, we also do need to push back against anybody who has that strong ableist attitude, because there are going to be people who are going to deny access or try to refuse the ability of having us on and be part of the team. So I encourage just to really just have a positive attitude, portray yourself, who you are, and also be able to come to the table showing your skills and the services that you could provide.
That's great. So the next couple of questions go through different career options for disability researchers and health professionals, and we'll sort of cover both academic and non-academic options. So starting first on the academic side, what do you think are the advantages and disadvantages of academic careers for disability researchers and public health professionals?
I can go ahead and start for this one. So this is Mike again. So academic settings often will have more access to resources, support. So I know for a number of individuals, trainees, or even early career professionals who may have a disability might actually seek out academic medical programs because of that. With that being said, does not mean that it's impossible to go to a non-academic setting. That is probably going to require more advocacy on your part to make sure that those services are there. So that, again, the importance of having strong mentors, allies, and also a network that can allow you to find the appropriate resources or advocacy if needed. Also for non-academic settings, I know people do say that there's often going to be better pay in those settings. But in academic settings, you will have opportunities to collaborate, especially if you're thinking getting involved in a disability health career, collaboration, being able to synergize your efforts with others. There's a lot more opportunities in that.
I think the pros and cons are, as Mike mentioned, but it's really where someone sees themselves, right? And, the one I'd say disadvantage of an academic career is the limited number of options that are there. And then this goes back to what we were previously talking about, sort of, the lack of importance of an understanding of this research and inclusion of the body of work. And most of it still, unfortunately, focuses on children with special health needs and on the children, the population, but not on adults, and not sort of across the lifespan. But it's changing, and we're seeing that change, and so hopefully this generation and future generations of researchers will find more academic options. And I think the other sort of disadvantage is limited research funding, and limited number of mentors and all of that. So, but again, we're in a pivotal point and definitely I see the change, and I've been doing this for probably longer than any of you here. And I absolutely see that there's, I'm invited to give talks in universities that that really this was not a part of their body of work. So, and it's wonderful to see that.
And building off that, I actually left academia because I wanted to work on an area where I could use my research and implement it into the community, but also do some advocacy at the same time. And I felt like in a position in public health in a disability organization, it really enabled me the opportunity to jump across those different domains of research and figure out how I could take applied policy research applied to broader public health data analysis and vice versa. How could we feed data into the bigger policy and advocacy efforts while making sure that it's not so negative, to show that there are positive outcomes for the disabled community, that it's not just a negative based approach.
That's a great point, and that's a good segue actually to the next question, which is what are some non-academic career options for disability researchers and public health professionals? So Vijay, I don't know, do you want to expand maybe on your experience?
Yeah, because I would love to do a little more, because I came at it into my organization in a different framework. They seem to understand disability to a certain level, but where it differed was a little bit was they didn't understand public health. So coming in to explain that public health is more than just a prevalence number, it's more than just a count. It's actually creating something where we can implement change, partnering with other organizations and institutions so that we can explore a broader range of topics like education, employment, housing, but utilizing a larger data set to show that what are some of the positive outcomes by addressing these social determinants.
Great. And what about others? Any ideas of options for non-academic career options in this field?
I'm going to say state, public health departments. Many public health departments, for example, really have a disability and health program, or some of them have MCH funded sort of programs that are focused on children with special healthcare needs, or children, disabled children. Also a lot of policy organizations, the usual suspects, but I think there's, and of course, disability-led advocacy organizations, and there are several really stellar disability-led policy organizations that are also hiring, researchers and so I think there are probably more non-academic options than there are academic options. But also when we're thinking of academic options, it doesn't even, the trajectory shouldn't just be a faculty level position. There are research scientist position, research associate positions that are in these, so it's not just, and they could be PhD level, they could be master's level, bachelor's level. So there's a spectrum of positions in research institutes which are also within academic, within universities.
This is Mike. So non-academic settings, what I have noticed, some of my contacts and friends don't discount consulting. So often they will set up companies to provide consulting work, whether they're guiding, for example, healthcare institutions on how to improve their access, what kind of accommodations that are required. Also, tech is a big area industry. So app development for a lot of these health promotion programs. So tech is certainly growing and is another option for many individuals who are looking for non-academic careers. And given that with the pandemic, we have moved quite a bit from now we have these hybrid models. We have more tools to communicate remotely or in person. So there's certainly, I agree with Monika that there's more opportunities outside the academic settings. I think really what's going to be key is finding your passions and see where that's going to fit best, whether it's in an academic or non-academic setting.
I think too, it's also depending on what level of work you want to do. If you want to work at a national level, at a national organization or state or local, you'll find different disability and public health organizations doing that, whether it's a state or county health department or a local center for independent living. You could mutually benefit at being at the nexus of those two different areas of disability and public health.
It's a great point. A lot of it is about fit and figuring out what you want to do. I have one more question in this section, and then we'll circle back to a question that's come up in the Q&A. We've already talked about navigating conversations about disability-related access needs in academic settings, but I think a kind of unique and often challenging aspect is navigating these conversations when you're on the job market. Looking for positions, negotiating positions, starting a new job. Any comments on that?
So as I mentioned before, sometimes it can be challenging to openly disclose, and some of that just because of the internalized negative feedback that we get from many others, and also this mostly ableistic environment that we work in. So it's really important to find those mentors, the allies, your networks. I would recommend to just talk about your strategies. What were their strategies in order to navigate and be able to request these accommodations? I don't want to really sugarcoat it. Unfortunately, making these requests, sometimes you still have pitfalls. People will try to be strategic in dismissing you, whether it's early on in the application process. So talking with your networks and mentors can be really valuable to kind of figure out how to navigate. So I know I did that with my life mentor, in addition to my career mentors, to find out what's the best approach, practice with them, and figure out how we can get the foot in the door. Really what's key is getting in there and really just talking about who you are, the skills and services that you bring. What happens is that a lot of people make assumptions when they just look at a resume or application or hear about a disability. And that's where we're so trying to avoid this sort of dismissal that happens there, or rejection. And so I encourage basically to have a strong network and understand that there are going to be challenges, and determining where you want to go after that challenge does come up. Sometimes that does require to have an attorney to be able to advocate or help you out.
Anyone else want to weigh in on that one? Monica?
So I think this goes back to there's a legal obligations, and then there's an environment that you want to be in. And I think finding out as much as you can, and again, before you make the decision is obviously, really important. What I've heard is the balance between sort of when you actually disclose. And I think often, again, unfortunately, based, because of sort of this ableist environment that we all live in, is often what people say they disclose after they get the job. So, again, for obvious reasons. So I think, really finding out, what's the best time to disclose. And then also getting a sense of how supportive, how inclusive is this environment.
Yeah, very important point. All right, so we're going to cover a couple of questions that are in the Q&A, and just a reminder to the audience, please do send us your questions. We want to make this as tailored as possible. I'll start with one about career pathways. So this individual says, for those interested in non-academic pathways, would you recommend postdoctoral training prior to entering the workforce? The difficult thing in my mind is the postdoc pay for 2 years, but I do acknowledge the need to strengthen research skills. Any thoughts on that? Postdocs before non-academic positions, Monika?
I'm going to say yes, for a couple of reasons. One is, you don't know what your career path is going to be, years from now. And I think the postdoc gives you, it's sort of, this 1, 2, 3 years where, you have the luxury of time and to be able to publish, produce, learn from people, learn from mentors, and really kind of soak in as much as you can. And, you're in a better place for that next step. Now, again, if your next step is hypothetically working at Apple or IBM, and you really don't see yourself going into an academic trajectory where you don't need publications and you don't need to know how to write grants, etc., then maybe not. But I think if you're looking for a policy organization or a consulting organization where all of this, while it's non-academic, the value that is placed on publications and structuring grants and contracts, etc., then I would say I would do a postdoc. Mike?
It's Mike. So I actually did a postdoc after a couple of years in when I was a practicing physician. And part of that, I recognized that I wanted to get more research training because of the issues that came up often, especially with my deaf patients, around health literacy, health communication, some more system-based barriers that we were trying to address. And I kept going back where I needed to have that research skills and training that I did not get in medical school. And so the postdoc was really valuable in having that protected time to get additional skills, also to get my master's of public health. But in addition to that, it really helped me find the mentors, like Monika mentioned, and that, that key set of mentors were really valuable in helping me find the network, which also opened up additional career opportunities. So it does often, doors often open up further when you do a postdoc. I totally agree. It really depends on where you're aiming for, because a postdoc may not be valuable for you, but if you, like in my case, was getting more additional research skills, training, that was really critical for my growth.
And I did a postdoc after my academic career. It just kind of reacclimated me to the research world. And this was before the pandemic. So now I've heard of so the opportunities of remote postdocs, I believe, might be there depending on the institution, but other non-academic institutions do offer remote fellowship opportunities. But the limiting factor there that I've experienced is that you don't have that collaborative opportunity that you would at an academic institution with the mentor that you have, with the variety of research that is being conducted there. But the fellowship at a non-academic site might be more specific to a project where you're doing one role at a time.
That's great. So you've answered the question about remote postdocs, and I agree. I think it depends on the institution, but I've certainly heard of some as well. Another career related question in the Q&A, and this is for you, Vijay, if you can speak more about your work and pivot to data science specifically. So this person is a doctoral candidate with experience in disabilities and lived experience, due to graduate this summer, and have been working to make the transition. But of course, the information out there is quite overwhelming and mentors difficult to come by. So any more thoughts on that piece?
Yeah, my role as a data scientist on this one is I kind of fell into it by accident through the connections and networking that I had made through the disability section of the American Public Health Association. It enabled me to utilize the research and experience that I've gained through my postdocs to show that I had the skill set to perform some data science work. But where my real strength lied was at that nexus point of policy and advocacy, and also true public health work and implementation science. And when they realized that I could do that work across those different levels, it enabled them to take a chance on me, I guess.
Speaks to the importance of networking and building that group of people around you. I'm going to switch gears a little bit to a question that came up earlier related to our conversation about showing the importance of disability-related work. So this individual is wondering about advice on how to pitch a disability-related grant or publication to organizations and journals that are not already heavily involved in disability-related work. Any thoughts on that?
Honestly, I think this is something I struggle with even today, because when you're writing a grant, you have no idea who's reviewing it, particularly an NIH grant. So it's very, very, you have to tread carefully. And you cannot, again, not knowing who the reviewer base is, you don't know about their ableist assumptions. Like, for example, my grants on pregnancy and perinatal health of women with disabilities, and I think Hillary and Mike, you get this, is that you don't know who's reviewing it and whether they have these incredibly ableist assumptions on who should be pregnant and who shouldn't, right? But so you have to frame it, and you have to cite, and you have to provide the data. And I think that's sort of, and hope for the best. But I think really the importance of framing it, and don't sort of, and the other piece I'm going to say is go with your own principles. So for a lot of the NIH grants, which don't really require community engaged research, I mean, I think that's changing. I've always actually, have put that in, whether it's a NIDLAG or NIH grant, because that's the way I've felt it's important to frame the research. So I think the same thing with this is frame disability in the way that it should be framed, and your research is framing it. So don't give in to the ableist assumptions, is what I'm saying.
This is Mike. I agree with Monika's comments. It's a very challenging area to navigate. What I do frequently encounter is that they will often say disability, those who have a disability is a small population. And it's really key in your background in the introduction section to review that. So demonstrate that this is a large population. So people even describe it as being the largest minority population in the US. So it's important to do that. And also understand that there may be times when you're dealing with a specific type of disability, so the population may get smaller. What I would suggest is really just highlighting that the gaps, whether it's healthcare related gaps, can actually be much greater than what we see in the general population. So a proposed intervention might actually have a larger effect size. You might have bigger impact on a certain individual. And so it's important to build that case, just highlighting that these are individuals that have substantial gaps, and it may actually be a larger group than you think. So that I would encourage maybe those two approaches too. But yeah, we have more to do in terms of informing our reviewers. So.
All right. These are great words of wisdom. I want to switch gears a little bit to a bit more of a personal question, but I think it's one that comes up and that we don't talk about enough, which is, what advice do you have for navigating work-life balance as a researcher or public health professional in this field? So children, other caregiving responsibilities, rest time, hobbies, stress management, all of those things that are important parts of our lives. Any advice for navigating this balance?
That is hard, and one of those topic areas which I'm still struggling with, to try and separate my work life from my family life. I have 2 kids who are under 6 and under, so making sure like I devote enough time for them. It takes dedication, I think, to separate when I'm at work, it is only work time. But then when I am done, I close my laptop, I turn off my phone, and I just go away. It is a definite challenge though, because at times in the back of my mind, I do suspect that there might be an email that come in or some other problem. But luckily, a lot of those situations are usually okay till the following morning, where I have a little more sleep under me to make a better decision.
So I think one thing to remember is what your balance is, and what feels right to you, or what feels right to someone else is not what feels right to you. So it's a very individual thing. And I know over time, sometimes I'm like, oh my God, so-and-so is producing so much, or so-and-so is doing so much. But that's not right for you. You know, you have to make it for yourself. You have to be true to yourself. And I, for example, after I finished my PhD, for 10 years, I worked at the Department of Public Health. I didn't jump into academia, and it didn't at that time, you know, I had young children, and that was the priority for me. I needed a job which was strictly 9 to 5. And that worked. And then, you know, after a point, when my older one went to middle school, is when I transitioned to academia. And I'm really, you know, I mean, again, it's sort of delayed my academic trajectory, but I would do that all over again. So it is a work in progress, as Vijay said. And again, what feels right for someone else doesn't feel right for you. And what feels right for you today might not feel right for you a year from now, or even a month from now. So it's something you constantly navigate. And I think particularly in the Zoom environment, we are all globally facing this, because work, it was bad enough with an iPhone, but now with Zoom, it's in your living room, in your, you know, all over your house. And I think it's hard, but it's very important to do.
This is Mike. So I agree with the comments made so far. And I also personally do struggle with this as well. I did have a bout of severe vertigo a few years back. And that was when I recognized that I had to balance the work, and work-life balance needed to get better, better allocated to personal time, family time, as well as work. So what I did recognize is that I needed to delegate more. So for example, in family medicine, often we try to do everything, and recognize that we need to also rely on our team members, whether it's colleagues, nurses, medical assistants. That same approach is also going to be the same for when you think about research. Having a team is going to be valuable, whether it's postdocs, staff, coordinators, other colleagues in that environment. So just recognizing what are things that you need to be involved and what are things that you could pass on. And this also brings up one of the keys for growing this workforce of trainees and students, early career professionals with disabilities. It's giving them opportunities too. So whether there may be a potential manuscript or a project that they can get involved, that might help with their resume and application too.
Great. So again, the importance of a team comes up again. So the next one might be a little bit tricky, but I think it's an interesting one, more of a reflective question. What do you know now that you wish you had known when you were a trainee or early career researcher, or when you started your job? So kind of a hindsight is 2020 type of question.
That's tough. Go ahead.
So this is Mike. For me personally, is understanding that I don't have to do everything myself. Also the importance of self-advocacy. So I mentioned that it took me a while to stand up for things that I felt were not appropriate, whether they were a denial for accommodations. And so the importance of having a team to support you through that and advocating it, because that can make a difference for others as well. So those are things that I personally, just looking back, I feel is critical to do it early, frequent, so that you don't get those constant denials, and hopefully it will be easier for the future workforce.
I think for me it was don't compare my resume and CV to others. Seeing the level of productivity that others were capable of did not mirror what I wanted to do. But then it caused a level of anxiety and panic in my professional trajectory, especially when I was looking at someone who was more senior to me and seeing like the level of work that they've done, but without the realization that that was their career in a handful of pages, whereas my career was just getting started. And it didn't make sense for me to compare myself to them.
Yeah, I agree with everything that Mike and Vijay said, and I want to add that the importance of mentoring and collaboration. So the importance of seeking mentors, not one mentor, or not just one mentor, not just one formal mentor, but just people who are, might be in some other professional or some other type of research that's going. But I think just really kind of creating this environment of I keep using the word support, but kind of almost like wraparound supports and a cocoon where you will be where you can ask random questions that are when you're facing a challenge. So I wish I did that sort of instinctively, but I think again, when I started my career, these words like mentoring wasn't a thing, and also collaboration. It's whether we call it networking or collaboration, and to those who are attending, your peers are your collaborators. For example, those who are the mentees in the disability section, the mentoring program, seek out each other, not just the mentors, but create sort of this environment within, and because that's your cohort as you're moving forward in this profession.
Thank you. And I see in the Q&A that others definitely identify with the idea of imposter syndrome, which I think you alluded to, Vijay, and I know many of us also experience at various points. So we have about 5 minutes left. Maybe I'll pose one last reflective question, and I'll pair it with a question that's in the Q&A. So the question is, looking back at your career, did it turn out as you expected? And the addition to that from the Q&A is specifically for Monika, which is maybe to reflect a little bit more on your pathway after the PhD in the public health department. So any last reflections from people on your career trajectory and where it's led you?
So I can start with the DPH. I worked at the Mass Department of Public Health. And again, after I finished my PhD, I'd already, I was pregnant with my older son. I didn't want to get into academia. And there was this job that opened up at the Mass Department of Public Health, which was absolutely ideal. It just sort of this, they were looking for someone who's an epidemiologist with experience, large national data sets, focus on disability. And again, remember, this is 1999. It's really, where there were very few data sets that actually had disability or people of any knowledge whatsoever. And I worked there, and it was such an amazing learning opportunity for me. I mean, I was primarily doing analysis of BRFSS and, some other longitudinal, a couple of other data sets that were the first national longitudinal data survey on people with disabilities. But I really got to working with folks at the department, mentors, and really understood the importance of community engaged research. I mean, that was like pivotal, and it's really kind of something that stayed with me throughout. And it's made me a better researcher. It's made me, a better academic and in everything that I do. So it really was foundational. What my career, okay, it was much better than I expected. It's really been something that's been amazing, and I have always loved what I've done, and I absolutely love what I do now. I cannot imagine doing anything else, both in terms of the research that I do, in terms of the institute that I lead, and the work that we do. It's really important. It's more and more important, and I'm very grateful to have followed the path that I kind of instinctively followed.
That's great. Any other reflections from others on your career path? Mike?
So most of us, our road is not going to just be one straight highway. Most of us are going to have side tours or scenic tours, and that's okay. And for me, that was more the case where there was not just one straight shot. And I think that made the experience more rich. I also feel that my journey, when I initially thought I was just going to be a practicing physician in a non-academic setting, to one where I incorporate research, medical education, and continue my career as a physician caring for patients. I think it makes, for me, I'm excited about that. It gives me a lot of opportunity to try to integrate disability health in a variety of different arenas. And so I've enjoyed my journey. It hasn't always been straight, but I've enjoyed those scenic tours too.
I concur, because I never thought I would go from working at a Center for Independent Living to being in academia to then leaving academia to where I'm at now. But it was at times very stressful, but I wouldn't change it because it kind of taught me who I am and got me to where I was here.
Fantastic. Well, thank you, everyone. That's actually perfect timing because we're just about 1 minute away from the end of our time. I just want to thank Mike, Monika, and Vijay for a really excellent session. I know I learned a lot. It was a real pleasure listening to this. As we close, I just want to remind everyone that you will receive a survey about the webinar today, and we will also be publishing the recording of this on the website. And I believe Sarah will be putting a link for the website into the chat in just a moment. There we go. So you'll be able to access the recording afterwards. And with that, we'll say thank you to everyone. Thanks for all who attended and the great questions you posed. We hope that this was helpful and look forward to connecting again soon. Thanks, everyone.